Hello, everyone. I'm Coletta Dorado, founder and CEO of AZZLY. We are a comprehensive behavioral health, mental health, and addiction treatment software. This is our specialty. This is our niche. I'm very pleased today to be able to have the opportunity to work with Bonnie Saxman. Bonnie is the CEO of First Dragon. She and her team have been working with AZZLY as we introduce AI functionality within the AZZLY Rize platform. We're extraordinarily excited about the benefit that this product offers for any licensed individual working in behavioral health, mental health, substance use disorder. It is perfect. It literally is perfect for what you need to do as far as the documentation and the requirements that it covers. So with that, I want to introduce the demonstration part of this video. James Seitz from the First Dragon team, as well as Maria Gray. Maria is product manager and lead implementation specialist at AZZLY. She's got over 10 years experience working in this field, really knows her space well. And James, because he's a product expert at First Dragon, knows his product well. And I'm really pleased at the results that we're going to be able to show you and the ease of use within the AZZLY Rize system. At the end, you will see there's an opportunity to have a 14-day trial. Bonnie and her team are proficient on AZZLY Rize and can easily demonstrate how it can be used, how you can subscribe through their platform and use it within AZZLY Rize. So with that, I'm turning it over to James and Maria. Thank you.
All right, thank you. I'm just going to share my screen here.
Thank you, Coletta.
All right, so here we can see I have a test patient open within AZZLY, and then on the right-hand side here, I'm sharing my cell phone screen. So this is what users can expect to see with DAX Copilot. When you're ready to start an encounter with DAX, we'll just press this plus button here, and it will bring us to this next screen to remind the user to get the patient's consent, as it is recording them during their visit. DAX doesn't keep the voice recording, so the audio can't be played back. It's just for transcription. And then after getting the consent from the patient, the user will just press the microphone button in the bottom right corner to begin. Patient is a 40-year-old female who comes in for depression follow-up. Hi, Maria. How have you been doing since our last visit?
That's a loaded question, James. I have been struggling quite a bit with a bit of anxiety and stress, to be honest.
Okay. Can you elaborate a little bit more on how are you struggling?
Well, like I said, my anxiety's been elevated. My stress level doesn't seem very manageable, and my symptoms just haven't really seemed to improve with the medication. I haven't really been feeling very great, and I haven't been out a whole lot. I've just still been feeling pretty depressed.
Okay. And have you been taking your medication regularly? And have you had any thoughts of hurting yourself or others?
I admit I haven't been as compliant as I could be. I do try to take it most days, but I've missed a few in between. As far as thoughts of harming myself or others, no, I definitely don't have any thoughts of harming myself. Others could be questionable from day to day. I'm just kidding, James. No, no thoughts there.
Okay. And are you having any side effects with Zoloft? We have had you on 100 milligrams for a few weeks now.
I've had a few headaches and I've had trouble sleeping. I seem to be waking up really early in the morning and then I have trouble going back to sleep, which is very frustrating. I feel like that contributes to definitely my anxiety throughout the day, and then it doesn't help my depression either. I've also had some dry mouth and increased sweating.
Okay. And are you drinking any more caffeine on a daily basis? How much do you drink a day, and are you drinking any late at night?
I'm embarrassed to say how much caffeine I consume a day, but I will say that it hasn't changed since I began the medication. I may be having a little bit more green tea in the evenings than normal, but other than that, it's been consistent with prior to starting the medication.
Okay, because insomnia can potentially worsen your depression, we will need to address this. Have you had any changes in your appetite at all?
My appetite has definitely increased. That has been quite bothersome.
Okay, and are you engaging in any physical activity?
The healthy thing to do. No, I think that if I could just get more sleep at night, then it would be easier. But I do have 3 dogs that need me to get outside and play with them. So, you know, getting involved with my dogs, taking them on walks, that would probably be a good way to get outside a little bit easier.
All right, yes, because exercise can boost your mood, even if it is just walking a little bit outside. So yeah, do you think that you can do that, even if it's just around the block to start?
I think they'll hold me accountable. So yes, I can.
Okay, great. And can you just tell me about your support system?
Yeah, I struggle a little bit with the support system. You know, my closest family members do live out of town. I have a couple of close friends nearby. I just haven't felt like engaging as much, but luckily they are ones who, if I don't engage, they'll reach out to me. So I'm very grateful to have them. I just need to get more involved with them.
Yeah, well, that's good. And would you be willing to attend group therapy? Patients have good results knowing that other people are going through the same things they are, and it can give you a judgment-free outlet to express your feelings.
I have always heard very positive things about group therapy, so I'd be interested in trying it out.
Okay, great. And before you leave, we can go over the options and find the best group session for you. Do you have any questions for me?
Not at this time.
All right. Thank you for coming in today.
Thank you, James.
All right, and I just stopped the recording there, so Dax will be writing our note. And as you'll see in the note here, Dax is great at filtering out pieces of the conversation that aren't clinically relevant. So should a patient ever get off topic and begin talking about something such as the weather or their hobbies, you can engage in those conversations to establish a better relationship with your patient and don't have to worry about going back and removing that information from the note. Dax will know what to leave in and what to leave out. So we can just quickly look over this original summary here. It has our HPI. And as we keep going down here, it does have our assessment and plan. So now I am going to start another recording here. So with DAX, you can start and stop the recordings as many times as you need. So I'm going to start the recording again and add a monologue, and then DAX will revise the note with the new information. The patient appeared calm and well-nourished with appropriate clothing for the situation. She maintained good eye contact throughout the visit. Her behavior was cooperative, but her mood seemed sad and a bit anxious. She exhibited a logical and coherent thought process for the duration of today's visit. Because her symptoms have not improved much since beginning Zoloft, I'm going to increase the dosage to 150 milligrams once daily, as well as refer her to group therapy to complement the medication to provide the support she needs. I am also going to have her make a journal to document mood changes, sleep patterns, and any other side effects. She'll also be asked to limit caffeine intake and increase physical activity. We'll have another follow-up session in 2 weeks. All right, so I'll stop the recording there and we can see Dax will revise the note. So monologues are a great way to add additional information to your note if there's anything you don't want to say directly in front of the patient, as demonstrated here. But they can also be used to create the entire note if a patient ever doesn't consent to being recorded by DAX. Another great feature about DAX is that it is able to pick up on more than 2 parties in a conversation and still summarize one note. So that's great for more collaborative environments when a patient is accompanied by a spouse, parent, or child. And now that Dax has finished revising the note with the additional monologue, we'll quickly review it and then go over transferring the information from Dax into AZZLY. So we have our HPI here again. That is slightly revised, and then it added in our physical exam as well from the monologue, and it added a little bit of additional information to our assessment and plan. So now that we are done with the recordings, we'll just go ahead and press this edit button in the top right corner and press continue here. And here you would be able to add additional information with dictation if you wanted to add information into any of these other fields here. But I'm going to just go ahead and open up DAX on the computer here. And we will cover transferring the text over into AZZLY. Open DAX Copilot. All right. So now we have DAX open up here on the computer with our summary. So to transfer the text over from DAX into AZZLY, you'll just want to open up AZZLY and get into your text fields. So I'm going to open up this note and come down to this HPI field. And then we can just turn on the microphone and say, transfer HPI. Perfect. So that moved over the HPI. There are a few different ways that you can transfer the information over. So another way that you can do that is you can come down to your section here and press this copy button in the top right corner. And it has been copied to the clipboard. And then we'll click over into the physical exam within AZZLY. And then we can turn on the mic and say, paste that. All right, perfect. So that also sent over the physical exam for us. And then another option that you have is you can also drag and drop pieces of information over. So if you ever didn't want the entire notes section, you can also just take pieces of it. So if you highlight and then you would click and drag and drop it over into AZZLY as well. So that's another option that you have to transfer the text from DAX Copilot into AZZLY there. So that wraps up the demonstration portion of DAX into AZZLY, and I will send it back over to Coletta.
James and Maria, thank you so much for that presentation and demonstration of how easy it is to use and how truly accurate it is. The fact that, Maria, everything you stated was shown, and removing some of the little nuances that you mentioned, exactly what James had said. Your experience dealing with psychiatrists and medical practitioners that may be of a generation that's older and they're used to transcription, Maria, or they're used to scribes. How valuable do you see this tool for a licensed individual that they need this amount of detail in their notes?
Now, Coletta, you and I spoke about this last week, and I had mentioned that, you know, today's generation is great. They're enthusiastic about AI, and so they seem to embrace it fully. I'll just say generations that preceded them, you know, maybe a little hesitant on that, but I believe that having the experience of getting to witness how accurately these notes do populate, that none of the data is missed, but it does take out the filler words that are added in. It gives them a concise, precise note that is needed that's appropriate for a patient's chart, that's needed for compliance and review and for billing, and you know, is great. And speaking of scribes and transcription, you know, Dragon to me is one of it's like I guess I won't throw out other names out there in the world, but there are those names that are just associated with a product. And I believe in the medical world, Dragon is the dictation software, you know, so you can count on it. It's been around a long time. And so I believe inherently that's a name that they can trust. And dictation goes back to why they originally got in the field. And that applies for all generations. And that is to be able to interact with your patient, your client directly. The paperwork, it's just an unnecessary evil to a degree. Dragon allows you to get back to that one-on-one communication without having to worry about someone else in the room with you, without having to worry about recording it, remembering everything after the session and hoping that it's all included. You know, you don't have to, it takes out the scribe, which, you know, is also somebody that doesn't have to be paid or involved in the care. And it just allows them to, like I said, focus on what matters, that interaction with the patient, ensuring that they're making the progress that's needed. And as a side note, because of Dragon, the documentation is all captured into one in a note that's applicable.
Great, Maria, thank you so much. Bonnie and James have a wonderful opportunity, as I mentioned, and Matt, as I mentioned earlier. Their team has a trial opportunity that they're offering all AZZLY users. And as I say, they've worked with Maria, they know our product. It's very intuitive. Bonnie, it's a combination of Dragon and Copilot, right? As far as the subscription that they would have to utilize in order for it to work.
Yes, that is correct. So if they are not a current Dragon Medical One user, we will issue not only the Dragon Medical One trial license, but also the DAX Copilot trial license. So that will be done in tandem.
Excellent, great. So we will be putting up a QR code and additional information on how to access that. Bonnie, James, Maria, team, thank you so much. We're very excited about being a preferred partner with First Dragon and really encouraging all those that are frustrated with electronic health records and love the narrative and the ease of use of that to please consider a trial and check it out. Thank you. Have a great day.
Thank you.